Welcome to this explainer. Today, we are opening up what is essentially a high-stakes medical survival guide. We're going to reframe deadly poisons, environmental toxins, and even everyday overdoses as chemical adversaries. And their specific medical antidotes, those are the precise rescue keys we need to neutralize them. It's a genuinely fascinating look at how emergency medicine fights these invisible, cellular-level battles.
Okay, so here's our game plan for today. We'll be breaking down these invisible threats across 5 crucial categories: heavy metals and chelators, common drugs and reversals, deadly gases and toxins, alcohols and pesticides, and finally, acids and clinical signs.
All right, let's jump right into Section 1, heavy metals and chelators.
We're kicking off our survival guide by looking at severe environmental and industrial threats, situations where heavy metals completely disrupt the body's baseline chemistry. You know, toxicology is literally a lock-and-key science. Every single metal requires a highly targeted chemical compound called a chelator to safely extract it from the bloodstream. For copper, we use D-penicillamine, or BAL. Iron toxicity, that calls for desperioxamine. But check out how severe lead poisoning escalates the whole treatment plan. While mild to moderate lead exposure is handled with just EDTA, severe cases that result in encephalopathy need a really powerful combination of EDTA with BAL or DMSA. You can also see mercury and cadmium relying heavily on DMSA as their specific rescue key. It is, quite literally, chemical warfare with absolute precision.
Moving right along to Section 2, common drugs and reversals.
Let's see how this concept builds when we confront the everyday medicine cabinet dangers that can suddenly turn lethal. Now, in emergency medicine, recognizing patterns is everything. The number 3 here represents a highly specific, absolutely classic clinical triad for a very common emergency: morphine or opioid poisoning. If a patient comes in with a coma, pinpoint pupils, and severe respiratory depression, doctors immediately know what they're dealing with.
So when you're faced with a patient exhibiting those exact 3 critical symptoms, the ER clock is ticking fast. You have to find the exact chemical counterattack. How do you instantly reverse that respiratory depression before the brain is starved of oxygen?
Now, Loxone is the immediate hero here. It chemically outcompetes the opioid right at the receptor level, rapidly reversing the drug's deadly grip on the lungs. Honestly, it's one of the most dramatic and instantaneous reversals you'll ever witness in a hospital.
Now, for other common drugs, you absolutely need to memorize these life-saving matchups. Got an acetaminophen or paracetamol overdose? The immediate counterattack is N-acetylcysteine, or NAC. For benzodiazepines, your key is flumazenil. If the heart is failing from a digitalis overdose, you deploy digibind. And get this, for beta blockers, it might surprise you, but you actually use glucagon to rescue the heart's function. Finally, for cocaine toxicity, amyl nitrate is the go-to. Knowing these exact pairs, it's literally the difference between life and death.
Okay, Section 3, deadly gases and toxins. We are now entering the territory of terrifyingly invisible killers. Gases like carbon monoxide and cyanide infiltrate the body silently. Notice the necessary escalation of care here. With carbon monoxide, a moderate exposure just needs high-flow oxygen to flush the toxin out of the red blood cells. But severe cases, they require the intense pressure of hyperbaric oxygen therapy. The medical team actually has to carefully weigh this against the real risk of barotrauma, which is tissue damage caused by that very pressure. But to save the brain from oxygen starvation, it's a trade-off you have to make.
And then we have the ultimate invisible threat. Cyanide acts incredibly fast. It binds to the machinery inside your cells and just instantly halts their ability to use oxygen. The rescue operation here has to be rapid, and biochemically, it's pretty complex.
The mechanics of this rescue are actually kind of wild. The primary drug of choice is hydroxycobalamin. But look at step 2. You literally have to induce a different, normally dangerous blood condition called methemoglobinemia using nitrites. Why on earth would you do that? Because methemoglobin acts like a chemical magnet. It pulls the cyanide right away from the cell's vital respiratory machinery, so the cells can finally breathe again. Then you deploy the Eli Lilly cyanide kit.
Let's unpack that kit. It contains amyl nitrate, sodium nitrate, and sodium thiosulfate. This specific trio of chemicals works in perfect choreography. The nitrates create that methemoglobin magnet we just talked about, and then the sodium thiosulfate swoops in to convert the trapped cyanide into a harmless compound. Then the body can just easily flush it from the system. It's such an elegant, orchestrated rescue.
Shifting gears now to Section 4, alcohols and pesticides.
Moving away from the medicine cabinet and into industrial and agricultural hazards, we've got to understand how to stop toxic alcohols and nerve-targeting pesticides in their tracks. Take methanol poisoning. Methanol itself isn't actually what kills you, it's the toxic byproducts it turns into. So it might sound completely counterintuitive to treat alcohol poisoning with, well, more alcohol, but administering ethanol blocks a crucial enzyme called alcohol dehydrogenase. This completely stops the methanol from breaking down into those blinding deadly byproducts, buying the body time to pass it safely. You can also use fomepizole to achieve that exact same inhibition. Now we have a vital, life-saving distinction to make here between two types of pesticides that cause dangerous nerve overstimulation. For organophosphates, the treatment is a combo of atropine and oximes. But for carbamates, you use atropine only. Listen, giving oximes for carbamate poisoning is a severe medical error. The precise identification of the pesticide entirely dictates the exact rescue key.
Grounding this in clinical reality for a second, how does a doctor actually know when to stop pumping atropine into a poisoned patient? Because atropine blocks excessive nerve signaling, a physician knows the counterattack is finally winning only when they observe this one specific physical endpoint. The patient's airway secretions become completely dry and clear. It's a tangible, real-world sign of victory at the cellular level.
But you know, chemistry is unforgiving. Unlike the precise antidotes we've seen so far, some chemical adversaries, like the organochlorine DDT or pyrethroids, they just don't have a magic bullet. The harsh medical reality is they require supportive care only. Medical teams have to rely entirely on keeping the patient's vitals stable, supporting their breathing and heart, and basically just waiting for the body to fight off the toxin on its own.
Finally, we reach Section 5, Acids and Clinical Signs.
Let's look at the aftermath of how destructive acids ravage the body's baseline chemistry. These aren't just skin burns. They leave highly specific clinical clues in the blood that we have to decode. Here is that number 3 again, but this time it's highlighting a terrifyingly specific electrolyte triad caused by hydrofluoric acid poisoning. When this acid enters the body, it triggers a dangerous drop in calcium, a dangerous drop in magnesium, and a massive lethal spike in potassium. It just completely derails the body's electrical system.
Which brings us to a critical crossroad. All three of these toxic compounds, oxalic acid, hydrofluoric acid, and ethylene glycol, aggressively steal calcium from the bloodstream, causing severe hypocalcemia. So the medical team has to urgently find a chemical replacement to prevent sudden cardiac arrest. What's the move? IV calcium gluconate. It acts as the absolute universal hero here. By pumping this directly into the veins, doctors are actively replenishing the precise electrolyte that these acidic toxins depleted. It's stabilizing the heart and muscles right before they fail completely.
And it's not just harsh liquid acids that disrupt our chemistry. Take barium carbonate, commonly used as rat poison. It's just a white, completely odorless powder. But once ingested, it leaves a very distinct footprint by plummeting the patient's potassium levels, a condition called hypokalemia. Spotting that specific drop in potassium is exactly the clue that helps doctors solve the mystery of what the patient ingested.
We've covered an incredible amount of ground today. So, I'll leave you with this thought. In a high-stakes world filled with invisible chemical threats, are you ready to identify the poison and deploy the precise rescue key? As this explainer proves, while the toxic threats around us are vast, science has meticulously engineered a survival guide. You just have to know exactly where to look. Thanks for joining me, and stay curious out there.